Hi everyone, I'm Emily Wang and I'm the founder of the Food Pharmacy Network. This is my era. What about you?
Woo! Boop, 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 boop. This is my era podcast. We spark the minds that set the trends that change the world as we know. And it starts right now. So let's go. This is my era. Hosted by Kuda Visa and yours truly, Mr. Alexander Starr. This is my era. Represents everybody who knows they want a better world and does something about it. This is our era. What about you? What's up, goal-getters? My name is Alexander Starr alongside Kuda Visa, and you are tuned in to This Is My Era, the podcast. First, I want to thank y'all for the ratings and the reviews that you're giving us on iTunes. You have no idea how helpful those are. So if you haven't left one already, go ahead and drop a review under our podcast at your earliest convenience on iTunes. Thank you. Kuda, it's a beautiful day down here in South Florida. How you feeling up there?
It's beautiful. Any day that you're above the ground is a beautiful day.
Amen. Wake up in the morning, that's a lovely day. It's one of the phrases that I used to hear my grandma say. I'm not going to get into song, but what's special about today's episode is that we're circling back to the origins of This Is My Era, so to speak. If you remember from the very first couple episodes, we launched This Is My Era, the song and the speech at the Millennium Campus Conference back in 2014. And we're now starting a series of interviews featuring some Millennium Campus Fellows. What is that, you say? The Millennium Fellowship is a partnership between the Millennium Campus Network and the United Nations Impact. Students from 285 campuses across 57 nations applied, but only 11% were chosen this year, and we have one of them with us today. She's a student at Cornell University who's already taking action to make life better for other people. She's a Clinton Global Initiative selected participant. She's increasing access to healthy foods for food insecure patients in a healthcare setting. And she is a U.S. Chess Federation certified level 1 chess coach and tournament director. That sounds super boss, using chess to change the world as well. But I'll let her tell you all about that. We're talking with Miss Emily Wang. Good morning, Emily.
Good morning, Alexander and Kuda. Thank you so much for having me.
But of course, so we want to dive into what you're doing with the Food Pharmacy Network. First and foremost, why is food insecurity a passionate issue for you, and how did you first get started in combating it?
Absolutely. Food insecurity is something that hits really close to home. I actually grew up in a food insecure environment for a while as our parents were making the transition from moving to China, to Germany, to Canada, and then to the United States. And as I grew older and became more food insecure, I realized how much food is a social determinant of health and how it affects people's outcomes across the world. And I realized that 1 in 8 Americans are actually food insecure, and I really wanted to do something about that in college. And becoming part of the Millennium Campus Network gave me the resources and a platform to get started this semester on an initiative that connects food banks to health clinics to provide free fresh fruits and vegetables to patients across the United States.
So did you come up with the idea once you became involved with the Millennium Campus Network, or is this something that you had been working on?
This is an idea that I had for a little bit of the summer, but the Millennium Campus Network is all about taking action. So it really helped inspire me to take this idea to the next level and to form an organization that followed through with my idea.
Awesome. So as you know, MCN, that's family. Sam Vagar, that's family. So just really quick, how did you connect with MCN and with Sam?
Absolutely. I have been looking all over for social entrepreneurship opportunities just to see where I could take my idea and the possibilities that maybe somebody who is as young as I am could really take action in the world. And I mean, this is my era, you know. So
Hey, yes it
I
is.
found out through MCN that there are so many young people who are doing this and who are taking action and doing really great things. And I thought, I have an idea. Why can't that be me?
I love that. So how quickly were you able to find other Millennium Campus Fellows who wanted to collaborate with you on this project?
Sure. Cornell has a really great network of Millennium Campus Fellows on campus, and having shared my ideas with them, they were all super eager and supportive to counsel me and give me as many resources and ideas as each of them could. Even with their own projects as well, they still found time to help me out, and that's incredibly valuable to me.
So, Emily, great job on what you're doing and for taking action. I want to ask you more of like a fundamental question, which is, it could have been easy for you to say, you know, I'm in college, I have to focus on finishing school. I can do this later. So I want you to get a little deeper into what actually made you take action now when you have a lot of other priorities that are going on. Because I think it's a fundamental lesson for our audience to hear.
Absolutely. That's something that I have been thinking about and I still struggle with in planning my time at Cornell. Everybody has such limited time and there's so many activities and resources to engage in. And I first initially joined a lot of clubs when I came to Cornell. They met once a week and we made a little bit of progress every single day for an organization that had existed for a very long time. And one of them is called Annabelle's Grocery. It's very similar to the work that I'm doing right now, except it's focused on Cornell's campus. Annabelle's Grocery is a store that supports food insecurity on campus. We're a food desert at Cornell. There aren't very many stores near the school that are affordable for all students, and Annabelle's really tries to address those issues by really offering very affordable options to everybody on campus. So once I realized that things on campus are very, very important, but there's also hugely important issues within the communities around your campus. And so later in my Cornell career, I reached out to the Ithaca Free Clinic and I started volunteering there. It's something that, similar to something that I did in high school where I volunteered at the Yale New Haven Hospital, and I wanted to continue this experience to reach out to patient populations in my local community. And in working with the Ithaca Free Clinic, I really enjoyed my experience. It's a very unique clinic that combines both Eastern and Western medicine, and that's something I really love. But what I noticed amongst the patient populations after a couple of months is that they're very, very vulnerable. They're all uninsured, and they all seem to have difficulty with proper nutrition despite having so many chronic conditions, especially within the sector I worked in, which was the chronic care program. So, one thing that I find is really important when you're thinking about an idea is to do the proper research in exploring the community that you want to help and learning more about what exactly these people need instead of making assumptions and jumping right into thinking what you think these people need. And so after a couple of months of observation, I realized that these patients really, really needed a source of food, and many of them didn't want to go to local food banks and food pantries because of the stigma surrounding them, or because they were undocumented immigrants and you require a social security number and all sorts of documentations to even apply to get food from a food pantry. And after doing my research and really talking one-on-one with all these patients and seeing what they needed, I realized that having food supply within a free health clinic where these patients already go to on a daily basis and are not afraid to talk to people about these issues, they feel comfortable in this environment, and have access to physicians and clinicians and nutritionists who will support them in areas surrounding the food that they eat by just simply providing this food in this area is the perfect location. And we have been so successful just from this model. And I think that having done the research correctly and having reached out into a local community, I find that this is the best way that I've made my impact.
Wow. One thing that you mentioned that I want to touch on is time management. So how do you manage your time now that you have, this food network that you're working on, you're, working on, your Cornell studies. How do you then kind of like make sure that the 24 hours you have in a given day, you allocate it accordingly to your priorities?
Sure. So I actually have realized that there's so many things that I really want to do that sometimes you just need to take the time to do them if they're important enough to you. I actually took a semester off from Cornell. Right now I'm on my gap semester, and I'm actually calling in from New York City, which is a lot of fun. And I have spent much of the semester really accelerating the development of the food pharmacy network, as well as working in a traditional corporate environment to learn more about the business world and gain more skills and connections that could propel this venture forward. And it's been such a journey. I've grown so much and met so many amazing people. And I'm very passionate about letting people know that if there is something that's really bothering you and you can afford to take the time to engage in personal development and take time off college to pursue these goals, then absolutely you should do it. And I'm also lucky enough to have some friends who are joining me on this as well. And they're starting their own projects. And so that's very, very exciting for me.
That's beautiful. So basically, when you're passionate about something, get out there and do it. And if you don't already know how to make it happen, go start doing stuff that's going to help you learn. I mean, do you have mentors in your field who are kind of guiding the way for you?
Absolutely. There are some people within the company that I work at, PricewaterhouseCoopers, who have been absolutely integral in connecting me to our corporate sponsors who have provided food donations to thousands of patients, and as well as one of my friends who constantly inspires me. Her name is Nadia Okamoto, and she runs Period, which is one of the largest youth-run nonprofits in the United States. And it's been so valuable to work for her as her event director for PeriodCon 2019, the largest menstruation conference in the United States, but also to see her trajectory as somebody who started this organization so young and has grown it so much. She's also a college junior as well, who's taking time off with me. And being able to learn from her, but also work with her, has given me both the confidence and skills to start something of my own. And you really need to find these people, these mentors, and these peers who can inspire you, challenge you, and help you grow.
Definitely. The old African proverb said, if you want to go fast, go alone. If you want to go far, go together. So, question for you. Obviously, you're still in college, you're young, um, but yet you're working in a corporate environment now and you're dealing with, like you said, major corporate sponsors and partners. How do you approach, as a young person, now connecting with such large organizations? What does self-esteem in approaching somebody like Feeding America or Wegmans or Stop and Shop or Aldi, like these big chains, how does it feel for you, self-confidence wise, talking to them and partnering with them? And how do you approach those relationships?
In terms of self esteem, it's both empowering and humbling to know that if you just cold email some people or fill out a form without having met anybody, there's a possibility that people could want to work with you. And it really does help once you do start building that network when you do get involved with these corporations. Like I got many of my contacts through having worked for another large corporation, PwC. It works both ways. You can know people and you don't have to know people. And it's nice to know that in this business driven world, we can do both sometimes, especially if you have a mission and you have a compelling story and compelling impact that you want to make.
Amen. So y'all have a veggie prescriptions program. I love that. I happen to be a vegetarian, so like now I'm getting hungry.
Oh,
Yeah.
great.
Yeah. So give us some insight on veggie prescriptions and how do I get one? Because I want one.
Sure. So we added the veggie prescriptions program recently to some of our clinics, and we think it's a great way to really emphasize the link between health and nutrition. What we put into our mouths every day has such a big implication in the long term of our health outcomes. You are much more likely to get heart disease and diabetes and a whole host of chronic conditions that can be either treated or prevented with good nutrition. And we want to really connect doctors and patients more on that level. And so we have a couple of physicians who, in their appointments after writing traditional prescriptions and giving advice and counseling, they ask patients if they want a vegetable prescription. And after giving them this prescription, the patients can simply go to the food pharmacy directly in the clinic, and that is incredibly convenient. We think it's so important to not only have the material goods that we give to patients that so they can have access to this immediately, but also the support and counseling from a doctor or a nutritionist who will help them reach their weight and health goals and help them keep up with a proper nutrition regimen.
That is like awesome. I've never gone to the doctor and heard them say, yeah, I'm gonna write you a veggie prescription. Like, I just think that'll be like a dream come true. That's fly.
Yeah, definitely. I definitely think all hospitals should start doing this for sure.
100%. And you like, do you truly believe that? Do you believe that the right diet can like seriously like cure illnesses and cure diseases?
I think so. There are a couple of research papers on this, and I have heard also personal anecdotal stories about people who have issues with their heart. Like my grandfather, for example, he has actually a small hole in his heart. He was a very traditional chain smoker and
Mm.
smoked a couple of packs a day, but also didn't eat very healthy. He never really ate any vegetables and the like. But after his doctor in China told him, you need to revamp your lifestyle and start changing the things you eat. And after 3 or 4 years, the hole in his heart actually closed up, and he was good as new. He looked
Wow.
a lot healthier and better, and could really engage in activities with his family and be the person who he was 20 years ago.
That's amazing. The hole in his heart closed off of him changing his
As
diet.
you were just talking, I was actually wondering, like, what do you eat on a regular day? I'm interested to just hear, like,
Right?
what do you eat for breakfast, lunch, and dinner, so I can take some notes and probably replicate the Emily Wang diet.
Absolutely. So for sure, I am human. Junk food and burgers and French fries are so good, and I love to indulge a couple times a month. Actually, there's, I think, no problem with doing that if it's occasional. But I try to eat as much vegetables as I can. Honestly, I think that's vegetables and fruits and fresh raw things are the best things that you can really do for yourself. There's a great nutritionist out on Cornell's campus. His name is T. Colin Campbell. He wrote a book called The China Study, which compared the diets of people in China with those in America. And
Uh-oh.
the Chinese diet is very light. It's pretty flavorful, and we eat a lot of vegetables normally, and fresh fish and meats and buns that are cooked in the oven on the very same day you buy them on the streets, versus the traditional McDonald's American diet that people have come to associate with our country. He gave so many great talks at Cornell, and I always enjoy attending them and learning more every time. And he advocates for a very plant-based diet. And I think out of all the nutrition plans out there that I've really explored, I think his nutrition plan is really backed by maybe 30 years of research in his lab. So I trust science and I trust Dr. Colin Campbell.
Nice. That's wonderful. So you said you're in New York City, which is great. I'm around that area too. So let's fast forward to, let's say, 5 years from now. You and I meet up in New York City for lunch. What update would you tell me in terms of like your project? Where do you want to see your network at, you know, in 2023, for example?
So by 2023, something that I hope to have is currently in maybe 3 months, we've acquired 5 really great active sponsors who are willing to donate food, and we're based in 15 clinics and totally operational in the New York City and New York, New England area. And I would really love to maybe be in 100 clinics by that time, or as many as possible across the United States. And I would love to also recruit more people who would be willing to help out on our board and other positions for sure within the food pharmacy. You can't do this whole thing by yourself, even though I feel like this program is my baby and I want to micromanage and I want to sort of oversee every single part of it. I know that in 5 years, if we really grow and expand, I want to be able to say that I have a very large team of people who are willing to oversee this project with me. And currently I have a really 5 really great board members right now, but I know, and a whole host of volunteers who are willing to help out. But I think that in order to be able to scale a project as large as I envision, I really want to be able to find the right people. And that's something that I've been really thinking about currently. And I know will be a huge concern in 5 years if I haven't done it already.
Great. So do you want to set the time and place right now for our lunch meeting in 5 years?
Oh, absolutely. I think I'll add you to my calendar and send you a Gcal invite.
Okay, great. So another question I have for you is very, very simple. How can we help?
Absolutely. I think right now, I think in your own lives, it's important to watch out for your own health and to watch out for the health and food security status of those really close to you and take care of those around you first. Give to soup kitchens and food banks and food pantries who are supporting millions of people across the United States, including many wonderful organizations in where we are right now in New York City, the Food Bank of New York City and God's Help We Deliver as well. Just to think during this, especially during the winter and this holiday season, to really think about people outside your circle as well.
Thank you so much for sharing your 5-year goals and also ways that we can help. One last question I have for you, personally, as an entrepreneur and someone who's founded organizations myself, I kind of like empathize with you and your position. I know what it's like to be kind of like in the trenches, and you have this vision, and you're really working to get this vision materialized to come to life. And sometimes it can be really hard, right? And there are days when I felt like giving up, but I kept going. So for you, what keeps you going, especially in the times where it's not as rosy as you want it to be. So what keeps you motivated and inspired to not give up and to continue pushing this vision through?
What I think keeps me motivated is first knowing that it's all about the journey and not necessarily completely the end. It's really great to set very well-defined goals. As it's something that I've learned as part of the Millennium Campus Network, and it's something that's very emphasized. But to get to these goals, I call it the messy middle. It's very, very hard to do. So you first need to really break everything down into even smaller achievable steps, and to really strive every day to keep working. A moment that was especially difficult for me was coming to the New York City area, it's been really hard to find good donors down here, especially having started talking to clinics like the Weill Cornell Clinic and the New York City Free Clinic. We originally had Wegmans as our sponsor and Aldi, but there aren't very many stores down here who are willing to donate. So even though I had already told these clinics that we did have these sponsors and we could make it happen, but it was really disappointing to tell them that, oh, we have to wait, we have to change plans. And that was a huge setback for us, especially in moments where you can't really dig yourself out of the hole. You really need to reach out to the people around you. And sharing my concerns with my colleagues at work, they were able to connect me to Whole Foods and other organizations who have been really helpful in expanding our project. And yeah.
Awesome. So I need in a quick 10 to 15 second blurb, Emily, why is this your era?
So I think this is my era for sure, because even though I am in college still, I believe that age shouldn't be a defining factor in deciding who makes impact. It's completely possible for anybody with an idea to take action and find people and resources around you who will help make your idea a meaningful and inspiring project for others to follow.
That's perfect. That's perfect. This definitely is your era, and I need something from you. I think if you listen to the other episodes, you know what I'm about to ask you for. I need your drop. You ready to be a recording artist?
Oh, sure.
All right. So I just need you to say, something to the tune of, and you choose what you say. But what's up, world? This is Emily Wang, founder of Food Pharmacy Network, and this is my era. What about you?
Sure. All right. Hi, everyone. I'm Emily Wang, and I'm the founder of the Food Pharmacy Network. This is my era. What about you?
Woo!
I dedicate my time to making myself better, and it starts right now. This is
my era. Well, let's go.
This is my era. Oh yeah. This is my era. It's about that time. This is my era. Come on. This is my era. This is my era. What about you? Everybody runs the race. Some have what it takes, and others don't make it through. What about you? Stand up when they call your name. Stand out when you do your job. Let greatness notice you. If you're just wishing for glory, then what are you asking? Victory ain't sweet if you don't live through the pain. So many great ones before me found glory everlasting. This is what I came to do, came to be. Cause see, this is my era. Oh yeah. This is my era. It's about that time. This is my era. Come on. This is my era. This is my era. Come on. This is my era. What about you?
This is my era, this is my era. The mission and the vision never been so clearer. Seems like the world ain't getting no better. If you wanna see a change, take a look in the mirror now. You possess the key to unlock it. Open up the door, opportunities knocking. You can't deny. On this road that we're walking, there's gonna be some obstacles, but we'll keep on marching. Some will doubt you, even talk about you, but this world wouldn't be the same without you. Golden people on the rise, we know our value. Reaching the impossible, we'll show you how to. Don't know about you, but I know about me. I was born with everything I need to succeed. Living out the dreams, what I'm supposed to do, what I'm supposed to be. Cause see,
This is my era. This is my era. This is my era. This yeah, yeah. To be that change that we all wanna see, yeah, 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 whoa, whoa, whoa. And as long as I'm living and breathing, I reach for the sky, giving living a meaning. That's what I was put on earth to do. I'm on a mission for glory, a journey of passion. 'Cause victory ain't sweet if you don't play through the pain. So many great ones before me found glory everlasting. That's what I came to do, came to be. 'Cause see,
Oh yeah.
this is my era.